Your waist measurement right now is predicting how long you're going to live, not your weight on the scale, not your BMI, not even your total body fat percentage. The circumference around your abdomen, measured at the level of your belly button, is one of the most powerful predictors of mortality risk that medical science has identified. And most people have never measured it accurately or understood what it means. Right now, wrapped around your internal organs, there's a type of fat tissue that behaves completely differently from the fat under your skin. This fat, called visceral adipose tissue, is metabolically active in ways that most people find shocking. It's not just sitting there storing energy, it's actively secreting hormones, inflammatory molecules, and signaling compounds that are changing how your liver processes nutrients, how your pancreas produces insulin, how your blood vessels respond to pressure, and how your brain regulates appetite and energy balance. For decades, we've been focused on the wrong metric. We've been weighing ourselves, calculating BMI, and obsessing over total body weight. But the research now shows that where your fat is located matters far more than how much you weigh. Two people can have identical weight, identical BMI, and radically different health outcomes based entirely on whether their fat is distributed around their abdomen or stored subcutaneously under their skin. What I'm going to explain in the next 20 minutes is why visceral fat is so dangerous, how it accelerates biological aging through multiple pathways simultaneously, and most importantly, what actually reduces it. Because the strategies that work for visceral fat are different from general weight loss advice, and understanding that difference is the key to extending both lifespan and health span. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years working in EA, I've seen the consequences of metabolic disease in its most severe forms. I've treated the heart attacks, the strokes, the diabetic emergencies, and the organ failures that result from decades of visceral fat accumulation that nobody warned patients about. My goal now is to help people understand the mechanisms driving these diseases so they can prevent them years or decades before they become medical emergencies. Now, before we go any further, I want to make you a promise. I promise to keep creating the most helpful, scientifically grounded videos I possibly can to help you live longer and prevent the diseases I see in the emergency department every single day. All I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you don't think it was worth your time, or you haven't learned something genuinely useful about how your body stores and processes fat, then feel free to unsubscribe, no hard feelings whatsoever. But if you give me your time and attention, I'll give you everything I've learned from over a decade in medicine and from reviewing the research on body composition and longevity. So please help me out. Hit that subscribe button to help this channel reach more people like you. And let's continue. Phase 3, Foundation Building, the Science Layer, 2:30 to 10 o'clock. To understand why waist circumference predicts mortality better than body weight, we need to understand that not all fat tissue is the same. Your body has two fundamentally different types of fat storage, and they have completely different effects on your health and longevity. The first type is subcutaneous fat. This is the fat stored directly under your skin. You can pinch it with your fingers. It sits between your skin and your muscle layer. Subcutaneous fat is metabolically relatively inert, meaning it mostly just stores energy without producing large amounts of inflammatory or hormonal signals. This is the fat that accumulates on your thighs, your hips, your buttocks, and your arms. From a health perspective, subcutaneous fat is largely benign. It contributes to your total body weight, but it doesn't significantly increase disease risk unless it becomes extreme. The second type is visceral fat. This is fat stored deep inside your abdominal cavity, wrapped around your internal organs, including your liver, your pancreas, your intestines, and your kidneys. You cannot pinch visceral fat because it's internal. It doesn't sit under your skin, it sits behind your abdominal wall, surrounding the organs that regulate your metabolism. And this is where the problem begins, because visceral fat is not metabolically inert. It's one of the most active endocrine tissues in your entire body. Visceral fat produces and secretes dozens of different signaling molecules called adipokines. These include inflammatory cytokines like interleukin-6 and tumor necrosis factor alpha, which create chronic low-grade inflammation throughout your body. They include hormones like leptin and resistin, which interfere with insulin signaling and promote insulin resistance. They include compounds that affect your liver's production of cholesterol and triglycerides. And they include molecules that enter your bloodstream and travel to distant organs, affecting how those organs function. The reason visceral fat has such profound effects on health is because of its location and its drainage pattern. When subcutaneous fat releases substances into your bloodstream, those substances get diluted as they circulate through your entire body. But when visceral fat releases substances, they drain directly into the portal vein, which is the major blood vessel that carries blood from your intestines' abdominal organs straight to your liver. This means your liver is getting bombarded with inflammatory molecules and free fatty acids coming directly from visceral fat at high concentrations before those substances are diluted by the rest of your circulation. This has cascading effects. Your liver starts accumulating fat itself, which is called hepatic steatosis or fatty liver disease. As your liver becomes infiltrated with fat, it becomes less efficient at metabolizing nutrients, less responsive to insulin, and more likely to produce high levels of triglycerides and small dense LDL particles, which are the most atherogenic forms of cholesterol that drive cardiovascular disease. Your liver also becomes less efficient at clearing toxins and medications from your bloodstream, which affects everything from drug dosing to your body's ability to handle environmental exposures. At the same time, the inflammatory molecules being produced by visceral fat are circulating throughout your body and affecting distant organs. They reduce the sensitivity of muscle cells to insulin, which means glucose can't enter muscle tissue efficiently. They affect your pancreatic beta cells, which are the cells that produce insulin, causing them to work harder and eventually become exhausted. They promote endothelial dysfunction, which means the inner lining of your blood vessels loses its ability to produce nitric oxide and regulate blood pressure properly. And they appear to cross the blood-brain barrier and affect hypothalamic function, which controls appetite, energy expenditure, and metabolic rate. The research on visceral fat and mortality is remarkably consistent across different populations and study designs. A meta-analysis published in the European Heart Journal analysed data from over 650,000 individuals, followed for an average of 12 years. What they found was that waist circumference, which is a proxy measure for visceral fat, was a better predictor of all-cause mortality than BMI. For every 5 centimetre increase in waist circumference, there was an approximate 7% increase in mortality risk in men and a 9% increase in women. This relationship held even after adjusting for overall body weight, meaning that two people with identical weight but different waist circumferences had different mortality risks based on where their fat was stored. What makes visceral fat particularly insidious is that you can have dangerous levels of it while having a normal or only slightly elevated body weight. This condition is called metabolically obese normal weight, and it affects millions of people who look relatively lean but are carrying significant visceral fat. These individuals often have normal BMIs, pass standard weight-based health screenings, and have no idea they're at elevated risk for metabolic disease until they develop diabetes, cardiovascular disease, or fatty liver disease. The mechanisms linking visceral fat to shortened lifespan operate through multiple pathways simultaneously. The first pathway is insulin resistance and diabetes. Visceral fat is the primary driver of insulin resistance in most people. The inflammatory cytokines and free fatty acids released by visceral fat interfere with insulin signaling in muscle, liver, and fat tissue. Your cells stop responding to insulin properly, which means glucose can't enter cells efficiently. Your pancreas compensates by producing more insulin, which works initially but eventually leads to beta cell exhaustion and type 2 diabetes. Diabetes accelerates aging through multiple mechanisms, including glycation of proteins, oxidative stress, chronic inflammation, and microvascular damage that affects your kidneys, eyes, nerves, and blood vessels. The second pathway is cardiovascular disease. Visceral fat promotes atherosclerosis through several mechanisms. It increases production of small dense LDL particles, which penetrate arterial walls more easily than large buoyant LDL. It raises triglycerides and lowers HDL cholesterol. It promotes endothelial dysfunction and arterial stiffness. It increases blood pressure through effects on the renin-angiotensin-aldosterone system, and it creates a pro-inflammatory state that accelerates plaque formation in arteries. The combination of these effects dramatically increases the risk of heart attack and stroke, which are the leading causes of death in developed countries. The third pathway is cancer. The relationship between visceral fat and cancer risk is less well understood mechanically, but the epidemiological evidence is clear. Visceral fat is associated with increased risk of several cancers, including colorectal cancer, pancreatic cancer, breast cancer in postmenopausal women, and endometrial cancer. The proposed mechanisms include chronic inflammation creating a pro-carcinogenic environment, elevated insulin and insulin-like growth factor promoting cell proliferation, and disrupted sex hormone metabolism. Visceral fat appears to convert androgens to estrogens through aromatase activity, which affects hormone-sensitive tissues. The fourth pathway is liver disease. As visceral fat delivers inflammatory molecules and free fatty acids directly to the liver via the portal vein, the liver accumulates fat and becomes inflamed. This progresses from simple steatosis to non-alcoholic steatohepatitis, which is an inflammatory condition that can progress to fibrosis, cirrhosis, and liver failure. Non-alcoholic fatty liver disease is now the leading cause of liver disease in Western countries, and it's driven almost entirely by visceral fat accumulation. Here's what makes visceral fat so difficult to address, and why standard weight loss advice often fails. Visceral fat creates a metabolic environment that promotes its own accumulation. It's a self-reinforcing system, and breaking out of it requires understanding the trap you're in. When you have significant visceral fat, the inflammatory molecules and hormones it produces make you more insulin resistant. Insulin resistance means your body has to produce more insulin to maintain normal blood sugar levels. High insulin levels have a specific effect that most people don't know about. Insulin is a storage hormone. It signals your fat cells to store energy and prevents them from releasing stored fat for fuel. When insulin is chronically elevated, your body is locked into storage mode. You cannot effectively mobilize and burn visceral fat while insulin remains high. At the same time, insulin resistance affects your brain's response to leptin, which is the hormone that signals satiety and reduces appetite. When you're leptin resistant, your brain doesn't receive the signal that you have adequate energy stores. You feel hungry even when you have excess body fat. This drives increased food intake, which raises insulin further, which promotes more fat storage, which increases insulin resistance. It's a vicious cycle. The visceral fat trap is why calorie restriction alone often fails for people with significant abdominal obesity. If you simply reduce calories without addressing insulin levels and insulin resistance, your body responds by lowering metabolic rate to defend its fat stores. You feel tired, cold, and constantly hungry. Your body is trying to preserve the visceral fat because from an evolutionary perspective, fat stores meant survival. Your biology doesn't know you're trying to improve your health. It thinks you're starving. This is where the conventional advice of eat less and move more becomes insufficient. It's not that energy balance doesn't matter. It does. But for someone trapped in the visceral fat metabolic cycle, simply creating a caloric deficit through portion control triggers compensatory mechanisms that make sustained fat loss nearly impossible. You lose some weight initially, mostly from subcutaneous fat and muscle rather than visceral fat, and then you hit a plateau. Your metabolism slows, your hunger increases, and most people eventually regain the weight, often ending up with more visceral fat than they started with. The solution requires targeting the hormonal environment, specifically insulin. Visceral fat is uniquely sensitive to insulin levels. When insulin is high, visceral fat accumulates. When insulin is low and stays low for extended periods, visceral fat is mobilized and burned preferentially compared to subcutaneous fat. This happens because visceral adipocytes have more beta-adrenergic receptors, which are the receptors that respond to adrenaline and trigger fat breakdown. They're also more metabolically active, which means they release and take up fatty acids more readily than subcutaneous fat. What this means practically is that the most effective interventions for reducing visceral fat are those that lower insulin levels and improve insulin sensitivity. not just those that reduce total calories. These interventions include reducing refined carbohydrates and added sugars, which are the primary drivers of insulin secretion. They include increasing protein intake, which improves satiety and preserves muscle mass during fat loss. They include incorporating resistance training, which builds muscle that acts as a metabolic sink for glucose and improves insulin sensitivity. And they include time-restricted eating or intermittent fasting protocols, which create extended periods of low insulin that allow visceral fat mobilization. The research on these interventions, specifically targeting visceral fat, is compelling. Studies using CT scans or MRI to measure visceral fat directly have shown that low-carbohydrate diets reduce visceral fat more effectively than low-fat diets, even when total weight loss is similar. A study published in the Annals of Internal Medicine compared a low-carbohydrate diet to a low-fat diet in overweight adults. After 6 months, both groups lost similar amounts of total weight, but the low-carbohydrate group lost significantly more visceral fat. The mechanism is insulin reduction. By minimizing carbohydrate intake, particularly refined carbohydrates, insulin levels remain lower throughout the day, which allows sustained fat mobilization from visceral stores. Similarly, research on time-restricted eating has shown preferential loss of visceral fat. A study in Cell Metabolism examined metabolic effects of restricting eating to an 8-hour window versus eating throughout the day with identical caloric intake. The time-restricted group lost more visceral fat despite consuming the same number of calories. The mechanism appears to be the extended fasting period between dinner and the first meal the next day, during which insulin levels drop to baseline and remain low for 12 to 16 hours. This sustained low insulin state allows visceral fat to be mobilized and oxidized for energy. Resistance training specifically targets visceral fat through a different mechanism. When you build muscle mass, you increase the total amount of tissue in your body that can take up glucose from your bloodstream in response to insulin. Muscle is the primary site of glucose disposal after meals. More muscle means better insulin sensitivity, which means lower baseline insulin levels, which means reduced visceral fat accumulation and enhanced visceral fat mobilization. Studies have shown that resistance training reduces visceral fat even in the absence of significant total weight loss, which suggests it's working through metabolic improvement rather than just caloric expenditure. What becomes clear when you look at the totality of evidence is that visceral fat responds to metabolic interventions more effectively than it responds to simple caloric restriction. You need to change the hormonal environment, and that means addressing insulin resistance and chronically elevated insulin as the root causes, rather than just trying to create an energy deficit. If you're finding this explanation useful and you're starting to understand why the standard weight loss advice you've heard for years hasn't worked for reducing your waistline, please take a moment to subscribe to the channel. I'm focused on explaining the actual mechanisms rather than giving you superficial tips, because when you understand how your body works, you can make decisions that actually produce results. So if that approach resonates with you, hit subscribe and let's continue. Now that you understand what visceral fat is, why it's dangerous, and how the metabolic trap works, let's talk about the specific strategies that actually reduce it. These are not generic weight loss tips. These are targeted interventions that address the hormonal and metabolic drivers of visceral fat accumulation. The first and most important intervention is carbohydrate quality and quantity. Refined carbohydrates and added sugars are the primary dietary drivers of insulin secretion. Every time you consume foods like white bread, pasta, white rice, sugary drinks, pastries, or processed snacks, you create a rapid spike in blood glucose followed by a large insulin response. When this happens multiple times per day, every day, insulin never has a chance to fall to baseline levels. You remain in a state of chronic hyperinsulinemia, which locks visceral fat in place and promotes further accumulation. The solution is to shift toward whole food sources of carbohydrates that cause smaller, slower rises in blood glucose and insulin. This includes vegetables, which should form the foundation of your carbohydrate intake. It includes moderate amounts of whole grains like oats, quinoa, and brown rice if you tolerate them well. It includes legumes like lentils and beans, which provide both carbohydrate and fiber that slows glucose absorption. And it includes limited amounts of whole fruit, emphasizing berries and avoiding fruit juices or dried fruits that deliver concentrated sugar without the fiber matrix. For many people, particularly those with significant visceral fat accumulation and established insulin resistance, reducing total carbohydrate intake below 100 to 150 grams per day produces measurable improvements in visceral fat within weeks to months. This is not a ketogenic diet, which is typically below 50 grams of carbohydrate per day. This is moderate carbohydrate restriction focused on eliminating refined sources while keeping nutrient-dense whole food carbohydrates. The goal is lowering average insulin levels throughout the day while maintaining adequate nutrition and sustainability. The second intervention is increasing protein intake. Protein has several beneficial effects for visceral fat reduction. It increases satiety more effectively than carbohydrates or fats, which helps reduce total caloric intake without conscious restriction. It preserves lean muscle mass during fat loss, which maintains metabolic rate and insulin sensitivity. And it has a higher thermic effect than other macronutrients, meaning your body burns more calories digesting and processing protein than it does with carbohydrates or fats. The research suggests that protein intake of 1.6 to 2.2 grams per kilogram of body weight per day is optimal for fat loss while preserving muscle. For a 70 kilogram individual, that would be approximately 110 to 155 grams of protein per day. This is substantially higher than the standard dietary recommendations, but appears to be beneficial specifically for reducing visceral fat and improving body composition in middle-aged and older adults. The third intervention is resistance training at least 2 to 3 times per week. This is non-negotiable if your goal is reducing visceral fat and improving metabolic health. Resistance training builds muscle mass, which improves insulin sensitivity and glucose disposal. It creates metabolic stress that triggers beneficial adaptations, including increased mitochondrial density and improved fat oxidation. And it appears to specifically target visceral fat through mechanisms that are still being fully elucidated, but likely involve changes in inflammatory signaling and adipokine production. You do not need to become a bodybuilder or lift extremely heavy weights. What matters is progressive overload, meaning you gradually increase the challenge to your muscles over time. This can be achieved with bodyweight exercises, resistance bands, free weights, or machines. The key is consistency and progression. 2 to 3 sessions per week of 30 to 45 minutes each, focusing on major muscle groups with compound movements, is sufficient for most people. The fourth intervention is time-restricted eating. This means confining your eating to a consistent window of 8 to 10 hours per day, and fasting for the remaining 14 to 16 hours. The simplest approach is finishing dinner by 7 p.m. and not eating again until 9 or 10 a.m. the next morning. This creates an extended overnight fasting period during which insulin levels fall to baseline and remain low, allowing sustained fat mobilization. Time-restricted eating works synergistically with carbohydrate reduction. When you combine lower carbohydrate intake with time restriction, you maximize the amount of time your body spends in a low insulin state, conducive to visceral fat loss. You also simplify eating patterns, which often reduces total caloric intake without requiring conscious calorie counting. The fifth intervention is prioritizing sleep quality and duration. Poor sleep is strongly associated with visceral fat accumulation through multiple mechanisms. Sleep deprivation increases cortisol, which promotes visceral fat storage. It disrupts leptin and ghrelin signaling, which increases appetite and reduces satiety. It impairs insulin sensitivity, which raises baseline insulin levels. And it reduces motivation for physical activity and increases cravings for high carbohydrate foods. The research shows that adults sleeping less than 6 hours per night have significantly more visceral fat than those sleeping 7 to 8 hours, even after controlling for diet and exercise. Prioritizing sleep is not optional if you're serious about reducing visceral fat. This means establishing consistent sleep and wake times, creating a dark and cool sleeping environment, limiting screen exposure in the evening, and addressing any sleep disorders like sleep apnea that may be disrupting sleep quality. The sixth intervention is managing chronic stress. Psychological stress activates your hypothalamic pituitary adrenal axis, which increases cortisol production. Chronic elevated cortisol preferentially promotes visceral fat accumulation, while simultaneously breaking down muscle tissue and impairing insulin sensitivity. This is why people under chronic stress often gain weight specifically around their abdomen even when their diet hasn't changed. Stress management strategies that have been shown to reduce cortisol and improve metabolic markers include regular physical activity, mindfulness meditation, adequate sleep, social connection, and time in nature. These are not optional lifestyle accessories. For someone with significant visceral fat, chronic stress is actively working against every other intervention you're implementing. Finally, let me address measurement and tracking. The most accessible way to monitor visceral fat is waist circumference measured at the level of your belly button. For men, a waist circumference above 94 centimeters or 37 inches indicates increased metabolic risk, and above 102 centimeters or 40 inches indicates substantially increased risk. For women, the thresholds are 80 centimeters or 31.5 inches for increased risk, and 88 centimeters or 35 inches for substantially increased risk. Measure your waist circumference monthly using the same technique and the same time of day. Exhale normally, do not suck in your stomach, and measure at the level of your belly button with the tape parallel to the floor. Reductions in waist circumference, even without significant changes in total body weight, indicate successful visceral fat loss and metabolic improvement. In emergency medicine, I routinely see patients in their 50s and 60s experiencing heart attacks, strokes, and diabetic emergencies that could have been prevented if someone had explained to them 10 or 15 years earlier what visceral fat was doing to their body. These are not inevitable consequences of aging. They are consequences of decades of metabolic dysfunction that was reversible at multiple points along the way, but was never addressed because the patient was focused on the wrong metrics or received ineffective advice. What I've learned from clinical practice and from reviewing the research is that visceral fat is not just cosmetic, and it's not just about weight. It's a disease process. It's an endocrine organ producing inflammatory and metabolic signals that are actively shortening your lifespan and degrading your health span. The difference between someone who maintains low visceral fat levels into their 70s and 80s versus someone who accumulates significant visceral fat is often the difference between independence, the disability between healthy aging and chronic disease management. The interventions I've described are not extreme or unsustainable. They are evidence-based modifications to diet, exercise, sleep, and stress management that address the root causes of visceral fat accumulation, rather than just treating symptoms. They work because they target the hormonal environment, specifically insulin and cortisol, that determine whether your body stores or mobilizes abdominal fat. For most people over 45 who have accumulated visceral fat over years or decades, implementing these strategies can produce measurable reductions in waist circumference within 8 to 12 weeks and continued improvement over 6 to 12 months. You are not aiming for perfection or for the body composition of a 25-year-old athlete. You are aiming for metabolic health, which is defined by normal insulin sensitivity, normal inflammatory markers, normal liver function, and visceral fat levels that are not actively damaging your organs. That is achievable regardless of your starting point. It requires understanding the mechanisms, implementing the interventions consistently, and measuring progress using the right metrics. Waist circumference matters more than weight. Metabolic markers matter more than BMI. And the quality of your remaining years matters more than any number on a scale. If you found this video helpful and you now understand why your waistline is a more important health metric than your weight, please subscribe to the channel. I'm committed to explaining the mechanisms behind aging and disease so you can make informed decisions rather than following ineffective advice. And if you know someone who's been struggling with abdominal weight gain or who's frustrated that traditional dieting hasn't worked, share this video with them. Understanding the metabolic trap is the first step toward breaking out of it. Thank you for watching, and I'll see you in the next video.